Hi, my name is Dr. Bruce Lambert, your Port Credit Mississauga Chiropractor. I get asked by people who might be interested in seeing a chiropractor if what we do hurts. And as a chiropractor, my job is to adjust the spine. I adjust the spine to help improve the nervous system function and the spinal biomechanics. So the basic scenario is somebody comes in, they may have had an old injury that didn't heal properly, so there's an area in their spine that isn't moving properly. What that creates is stress in the nerves. The spine is also supposed to send clean information up to the brain, and if those joints aren't moving, you're not getting clean information. So we have a mechanical problem, a neurological problem. One of the things that also happens, if there is pressure on those nerves creating a breakdown in communication, the muscles around that area are going to spasm up really hard. They're going to feel like knots or ropes, and those are acting like bodyguards. And the brain knows that there's trouble in that area, and so it gets those bodyguards to literally protect that individual from themselves, to stop them from causing more stress into that particular area. So all these different factors are at play. The adjustments themselves, they do not hurt. But for instance, if somebody comes in with an old injury, they might be 40 years old, and it was an old football injury, an old skiing injury. A lady comes down the hill at the age of 20, and they almost miss that tree, but they clip it and they do some somersaults, and they have some injuries that don't heal well. We see that 20 years down the line, there's been scar tissue, muscle behaviors, and things like that. But the biggest thing is that those nerves have been irritated for all those years. And a good analogy that I give regarding how it feels is that you have your first adjustment, and all of a sudden we take all this pressure off of those nerves and clean information. A huge barrage of new information travels through those nerves from the body back up to the brain. So it's very much like stepping out of a dark room into a sunny day. All of a sudden it's blinding and it almost hurts, but it really doesn't hurt. It's just such a volume of stimulus, it really wakes us up. So it's not pain, it's gone in a split second because our nerve supply is moving at 300 meters per second. So it's like this burst of electricity, this burst of information that wakes us up, and then it goes away. Another thing that might happen a day or so after is what we call an adjustment reaction. Adjustment reaction, what's that? When somebody gets adjusted, they have all sorts of dynamic changes happening in their body. It's like plugging your brain back into the body sending information back to the brain, and you regain control of some coordination, muscle function, circulation changes, and just simple biomechanics. Some people walk in with high shoulders or torso shifts or even more weight on one leg than the other. And just the changes walking out of an office is like going to the gym for the first time after a long layoff. We redistribute some of those pounds that are shifted around, or we bring shoulders down, we bring the head back. All those things are truly like a workout. It's not lifting weights in the gym, it's lifting you, it's moving you. It's the body relearning how to regain normal function. And all those things are really, really positive. But an adjustment reaction may occur the next day or even the day after, and it's basically the after effects of using your body in this new and improved way. Very, very similar to working out. Oftentimes I find as well, people may be dehydrated, and as we're moving these joints, we're pumping nutrients in and we're taking garbage out, lactic acids and other metabolic wastes that have been in these areas that have been just holding on tight for a long, long time. We get motion into the body, which is fantastic, and it starts moving all this garbage out. And if you're not hydrated or not moving around, that junk, that garbage just sits around there, and it also can create this achiness. So an adjustment reaction isn't anything sinister, it isn't anything scary. It's simply the body's response to working different but better. So thanks for tuning in. If you have any questions, don't hesitate to contact me. Thank you very much.